I'm Jamie, and I'm the customer service manager at Murfreesboro Electric, and this is my story. I actually found out that I had breast cancer right after I turned 40. Actually, I found a lump myself, and I actually went to the doctor right after finding it, and of course had the test to see, ultrasound. Pretty quickly they decided to send me to a surgeon, and actually when I went to the surgeon to have a biopsy done, actually when he walked in the office, pretty quickly was surprised to hear from him when he looked at the ultrasound that he felt 99.9% sure that I had cancer at that point. And of course you go through just being shocked and surprised, because like I said, I had just turned 40 and no one in my family had ever had breast cancer. So just the thought of going through something like that was very surprising. And some of the things that really stick out to me is I did have another friend that was already been diagnosed with breast cancer, and looking to her and seeing what was going on, I guess with her body and the changes that were going on, I was very concerned. I was sent to I consider one of the best oncologists right after I had my surgery. I had a lumpectomy, and after that they determined that for me to go to the oncologist. I went to two. I actually went to Centennial in Nashville to a specialist for breast cancer. But then I actually went to Tennessee Oncology and actually met John Barton there. And right off the bat, kind of hit it off with him. And he really hadn't seen the type of cancer that I had at my age, because it's a type of cancer that usually strikes older women. And so he immediately reached out to MD Anderson in Texas to see what their protocol would be. Because when they first looked at it, I was going to have to go through some very harsh chemo. They actually called it Red Devil. And at that point, after he reached out to MD Anderson, it was determined that there was a new test called Oncotype DX. Unfortunately, at that time, which was in 2005, it was a test that the insurance companies wouldn't pay for. So after talking to him for some time, my husband and I decided that we would just pay for the test. It was probably going to be a few $1,000s. And what the test would show is if my treatment should involve chemo and what type of chemo, or if it could be treated with just a radiation and maybe some other medications. And at that point it was determined that I could do radiation and then also take some shots called Lupron and then continue on a medicine called tamoxifen. And so I kind of began that regimen of taking those different things. Radiation involved 8 weeks of radiation, and then the Lupron I took for about 1.5 years, and tamoxifen probably about 5 years is what I took. Kind of affected my family just because I was tired all the time, so it just kind of drained your energy. And then taking the shots really kind of changed my personality a little bit, sometimes to the extreme. Plus, when you haven't been used to taking any type of medicine, and trying to remember to take the medicine, it just really became such a part of my life. Then, since I was so young, I also, with my kids, they approached me about having gene testing to see if I actually carried the cancer gene. And at first, the decision I made was not to go through having the testing, because at that point, as Dr. Barton would always tell me, sometimes if you test for the cancer gene, it's just how far would you go to keep yourself from not having another form of cancer? And at that point, I didn't feel like I would take the preventative measures unless I already knew I had the cancer in a specific area. Then he talked to me about how important it was for my kids to kind of know, because they would need to be tested earlier. And so finally I did decide to do the gene testing to see if I carried the gene. and fortunately I do not carry the gene. And it's now been about 13 years, really 13 and a half years since I was first diagnosed with cancer. I'm actually considered cancer-free, and that point happened at 10 years. Actually a little bit before 10 years, because the doctor I had been seeing, he was actually retiring from Tennessee Oncology. And when I went to see him, he actually released me early. And he also told me that since I did that testing, that Oncotype DX testing, that he eventually got paid for us through our insurance company. That's become the normal protocol. Now when someone has breast cancer, or I believe colon cancer also, it's one of the first tests they do to help determine what type of chemo or radiation they do. But it's just been, like I said, just really shocking when you first hear you have cancer. And the more people you meet, you learn that people survive it. At that time, it was just devastating, but now most people I meet, when I do different types of cancer walks, it's interesting to see how many people are living with it, and the success rate is really great. So, breast cancer and cancer awareness is something really close to my heart.